And on that Captain Obvious report on Australia's COVID-19 response, well, let's be brutally honest here. It told us absolutely nothing we didn't already know. Next, we'll have an expert panel explain why water is wet and fire is hot. One wonders why the panel took 6 months to reach conclusions that were obvious to anyone paying attention more than 2 years ago. Some of us were even warning about the health, societal and economic consequences of lockdowns and other COVID-19 measures back in April 2020. But sadly, the bulk of the media, together with politicians, academia and health bureaucrats, were busy whipping up maximum fear and hysteria in the community. Those of us who criticised the draconian restrictions, particularly here at Sky News, were labelled granny killers and science deniers, despite the fact that it was emotion and politics, not science, that saw our leaders make monumental mistakes. Now, this report was commissioned by a bunch of rich listers, including billionaire Andrew Forrest's Minderoo Foundation, the John and Miriam Wylie Foundation, and the Paul Ramsay Foundation. We would have been better off if these powerful voices raised objections when it mattered to the overreach that saw state borders closed, saw families kept apart, children kicked off playgrounds, and the sick and frail left to die alone. Now, to be clear, I'm not disputing any of the conclusions reached in the Fault Lines review, just pointing out that we don't need academics and social influencers to state the bleeding obvious. Among the 97-page report's findings were rules were too often formulated and enforced in ways that lacked fairness and compassion. Surprise. Such overreach undermined public trust and confidence in the institutions that are vital to effective crisis response. And it was wrong to close entire school systems, particularly once new information indicated that schools were not high transmission environments. The report also found that significant mistakes were made and policies motivated by political considerations were often implemented without full appreciation of the consequences and the inequalities already in the community. None of that is remotely surprising nor informative, particularly if you've been watching Sky News, because we've been telling you that for more than 2.5 years. Anyone capable of critical thought could have listened to the leading experts in infectious diseases, pointing out that locking down healthy people was no way to deal with a respiratory illness that would become endemic. And we knew from early 2020 that coronavirus would become endemic. There are a lot of people trying to rewrite history right now. Don't let them get away with it. In 2020, I recall quoting renowned experts such as Dr. Martin Kulldorff, who implored governments not to impose lockdowns to fight COVID-19. We also heard from Oxford University Professor Dr. Gupta, Professor of Medicine at Stanford University, Dr. Jay Bhattacharya. These are people you heard on this station repeatedly. They were joined by thousands of other doctors, scientists and health professionals who signed the Great Barrington Declaration. But instead of being listened to, they were attacked, maligned and misrepresented. For more than 2.5 years, we've been quoting medical experts on this station cautioning against harsh restrictions, mandates and warning that lockdowns would do more long-term damage than good. But you didn't have to be an expert to see the disastrous unintended consequences of our COVID-19 response. I'm not a doctor, but in April 2020, I wrote in the Herald Sun, there's been some focus on the mental health costs of the restrictions and the resultant job losses and economic hardship, but not much said about the loss of life we can expect because the world has become entirely preoccupied with one virus with a fatality rate that has turned out to be far lower than first feared. April 2020, we were having those discussions. Now we are seeing a surge in excess deaths from the UK to right here in Australia. Only this week, we learned that there's been a significant jump in the number of alcohol-related deaths in Australia. We've got cancer specialists fearing that missed screenings will see many patients die prematurely. And the median age of these deaths isn't around 80, unlike deaths from or with COVID-19. We don't need more Captain Obvious reports. What we need is a reckoning. We need accountability from the politicians and the public health bureaucrats who needlessly destroyed so many lives by playing politics and choosing to ignore the full impact of their policies. If there are no real consequences for those who contributed to this period of madness, then we're at risk of having the entire catastrophe repeated the next time there's a new virus that's more virulent than the flu.